Yeah, welcome back. Another episode of the Punchy Kicky Show, and this conversation we're about to have with my guest is a difficult one. It's sad, but it's also maddening. It is absolutely frustrating. It's disgusting. It's despicable, from my point of view, anyway. And we're going to hear literally from, and I hope she doesn't see this as it comes out of my mouth, but we're going to be hearing it from the horse's mouth, directly from the source. So by way of introduction, she is, and she can correct me as you know, once I'm done here, but she started it all when it comes to female MMA in this country. First ever female roster fighter signed by the EFC in South Africa. She has paved the way for women in MMA in this country. But we're not here to talk about her MMA credentials. We're here to talk about her medical credentials, because this lady is also, she happens to be the head of the MMA Medical Commission here in South Africa, or the former head of the MMA Medical Commission here in South Africa. I am joined, thankfully, an honor to have you with us, Dr. Danella Eliasov. Thank you so much for your time, and thank you for, I don't want to say, thanks for talking about this disgusting, sorry, I'm using a really horrible word, but it's a saddening topic that we need to talk about, and that being the resignation of the MMA Medical Commission in South Africa. Welcome to the show, and geez, sorry I couldn't make it a nicer introduction.
Yeah, I mean, I'm also, can't say I'm happy to be here talking about this either. I was pretty excited to make changes for the athletes, to take better care of them, to get that process going. Unfortunately, during my career in MMA, one of my, I would say, colleagues in MMA suffered a severe brain injury, and another passed away, and I was there and I saw it. So that was sort of my motivation in kind of, let's not let that happen again.
So let's take it back to the beginning. What was it? 23rd of September last year, you were officially announced as joining MMA South Africa to head up the MMA Medical Commission. Couple of short weeks after that, we had announcements of a whole bunch of other medical colleagues that will be joining you in this very important, very, very serious component when it comes to mixed martial arts. And I mean, we need to understand, mixed martial arts is a dangerous sport. As you've mentioned before, many athletes have suffered some serious injuries. Many athletes have died as a result of participation in the sport. Let's not say as a result of competition, but participation in the sport. So medical advice, safety is paramount when it comes to the sport of MMA. So from those opening sort of discussions, what was the mandate given to you guys as the Medical Commission for MMA here in South Africa?
So the problem is that there wasn't. I had chatted to Ferdi Basson on occasion, and just I talk to anyone who will listen, because I'm very passionate about medical care in MMA, because I have a love for the sport. And he asked me if I would, in theory, be willing to get involved, and I said yes. And then I was quite flattered, surprised, but they appointed me as the commissioner, and they said I need to appoint a commission. So I thought about, who am I going to put on this commission? Who would be the best brains to kind of put together for this? So starting off with Rob Collins. So he's a sports physician. He's the doctor for the Lions rugby. He's treated a lot of us. He's treated me for fights. I fought with a dislocated collarbone. I fought with broken limbs. Rob Collins, thank you. He's glued all of us back together. And in terms of sports physician, you can't get better. So I thought, obviously, Rob Collins. Then we've got Evan Speechley, who is a world-class physio. I mean, they fly that all over the world. He looked after the 95 Rugby World Cup, the rugby team who won. I don't think anyone in MMA doesn't know him, because he's also pieced us all back together. His son was the welterweight champion, Adam Speechley. Evan Speechley, got him on the commission. And then the third person that I appointed, which maybe he isn't as familiar to the community, is Richard Mulder. So he brings a completely different sort of aspect to this. He is a background as a paramedic, and he's done a master's in emergency medicine. He used to he was in charge of the helicopters for Netcare. So when the helicopters went off to rescue people, he went to Antarctica to rescue someone. And he then subsequently did an MBA and went into sort of more the hospital management side of things. So the reason I pointed him was he knows how to get a person who's suffered a severe injury to hospital in record time. If there's a person who can tell me how to get that person to medical care quickly, if this is a horrible situation, but in the case where a person's had a severe brain bleed, it doesn't help to faff around at the event. We need to get them out of there fast to a neurosurgeon. And the person who knows how to do that is the person who ran Netcare's emergency services, so that he's there to sort of advise on processes, what paramedics we need, how many, I don't know that. Also in terms of processes, I don't know how to run a hospital. I don't know how to run a show. Doctors and physios, which is, who's on this board, we're not good at knowing processes. We know we get our patient served in front of us and we magically things appear and we work on them. We don't know who ordered the equipment. We don't know who drove the patient there. We just know how to do our job. So I needed someone who would put processes in place, which he did. So he's put in sort of protocols so that it's a no-brainer. It's a tick checklist. Something bad happens, no-brainer. What do you look for? And then what do you do to get this athlete to definitive urgent medical care within record time? So he put up like a sort of, so that was where he worked on the sort of the emergency protocols. The paramedics, sort of he put out requirements for what they needed on scene, what qualification, because I mean, there's anything from a first aider to an ECP, which is a highly qualified sort of paramedic. He said, how many of them do you need? I don't know that stuff. Rob and I don't know that stuff. Even we know how to treat patients. So so this is pretty much the commission that I appointed, and we started getting to work. Consulted with some neurosurgeons, radiologists, but I didn't want to put them on the commission. They didn't need to be. It's also very hard to convince medical specialists to be on a commission like this because you're not making any money from it, and you're busy in your practice and you don't have time. But Evan, Robin, and Richard very kindly, they had my back and they said, cool, we'll help you.
Okay, so obviously you created the picture, you found the correct pieces that you felt at the time, great pieces for the fit of this picture, and you put them together. That led to, obviously, like you've mentioned now, working on a set of protocols. And at some point, high-level protocols were announced by MMA South Africa as they came out of, or as a result of your recommendations. And then everything seemed to be going great because, you've got this commission. Well, first of all, we had the announcement. We had someone who'd been there, who'd had her, don't mind me saying, we've all seen you with your head split open on live TV coming out of a fight. So we had someone who's been there, done it all, literally out of the trenches, and now you were heading it up. So from a credibility point of view, the guys that are couch potatoes that just, your average weekend fan, right the way down to the guys that know the sport in and out, knew that medically speaking, the sport was in good hands. And then we hit Wednesday. A bombshell drops, and I'm looking at that post again that was put out by the Mixed Martial Arts Medical Commission of South Africa. And to paraphrase it, it was with great sadness that the lot of you resigned with immediate effect as a result of MMASA's inability or unwillingness, should I rather say, to accept the medical advice that you were giving them because they felt they only wanted to offer basic safety and medical assistance to our young athletes. Have I got it right?
So I think it comes as a bombshell. It's not really a bombshell. That we've obviously, when you appoint a commission, and South Africa's never really had a medical body overseeing the sport before, so there's going to be teething problems. And initially, it was things like COVID testing, which we had explained to them wasn't our rule. We didn't make that rule, that certain events had, when you run an MMA event during a pandemic, there was a government gazette that comes out that said you needed to PCR test all the athletes. And we sort of got flack for it because it costs a lot of money. And we tried to explain, well, we'll try and, Rob Collins actually had a contact at a lab that could do it for cheaper, but we said, unfortunately, that's not our rule, that's the government. So we can't have an illegal event. So you need to listen to those guidelines. But unfortunately, so that was a bit of an argument, which wasn't great because it's not, we got to, and then the sort of rumor propagates, I suppose, that we're asking for expensive medical tests. Well, we're not, the laws of the government. Then we had talked about concussion testing. We had a whole lot of meetings about it. I'd had a meeting with them about implementing baseline MRIs, because I think it's really, really important.
Yes.
And it's expensive, it's hard to implement, but that's where we needed to go. Sat in a meeting with them, sort of sold it to them, if I can say. When I say sold it to them, I mean, there's no benefit to me any other financial or other, but how we needed to that was one of the things we needed to head towards. They agreed, and then sort of held SA champs without putting in any, the emergency protocols, the pre-fight medical. We put we revamped that. And we saw that SA champs went ahead and we gave them all the documents. We went to the effort of it, and they just didn't use any of what we had said. We knew we would roll it out slowly, so there was sort of a timeline. COVID messed that up a bit, obviously, but how we can't possibly do all of this in one fell swoop, that we're going to roll it out slowly. But what we did want was that the pre-fight medicals were thorough, because I have been examined, and they look at you, take your blood pressure, and say, off you go. I mean, you can be, anything can be wrong with you and they won't pick it up. So again, checkbox list, have you examined the neurological system? What are the pupils like? So that they had to document all of that. So proper pre-fight medical. So that was what we wanted. They didn't use it. We didn't even know SA Champs was happening. They didn't invite us. They didn't, because I was sort of planning to go to.
Sorry. So you were the head of the medical commission. You didn't know that SA Champs, I'm assuming you found out via social media.
Yes. So what I had planned to do was, while we were rolling out these guidelines, and it's one of the medical commission to try go to most of the events. We obviously can't go to all of them, but in the beginning, just to be a presence so we can see where the teething problems are. And I see on Facebook, and then I'm thinking, there's all these kids fighting, and now they've got junior divisions, which means we've got developing brains, younger kids, that's a whole other kettle of fish. Now they're fighting. This is all under my name. I don't know about it. I'm not there. They're not using what I told them.
Wow.
So I obviously was, and then the rest of the commission, we were really, it's a problem, because if something happens, they're going to say Dr. Eliasov of the medical commission was unavailable for comment or whatever it be, and I look like an idiot. I've promised these guys I'd look after them, and I'm not able to. So we wrote them emails. We said, look, guys, this is not on. You need to communicate. We need to talk. That sort of talking about how they can't afford MRIs. It's a ridiculous thing to even ask for. Let's talk about it. How can we roll it out slowly? I actually found sponsors to put the athletes in a study where they would actually pay for the MRIs. So, I'm not saying give me millions and just make it happen. I'm saying, let's talk about it. COVID messed everything up. We can't roll things out as we hope. Let's talk. We sent them an email where we said, look, calls were not answered, emails, WhatsApp, we're busy. I'm busy. I'm not done with work now. It's late on a Friday afternoon, I still have a ward round. But I kept trying to make contact just to let's talk. Why aren't our guidelines being followed? Please, can you invite us to the events? Please, can you tell us when the events are so we can prepare? Ignored, sort of almost ghosted in a way. And then we sent an email saying we want monthly meetings. We want emails to be responded within 48 hours. We had sent them a bit of this is what, and we'd also before sent them a memorandum of understanding, because we didn't have a mandate, just to clarify our mandate. They never signed it. Kept asking, please sign it or edit it or whatever. They didn't. We then sent them an email saying, please, can we just agree on monthly meetings or some kind of standard of communication, because we can't talk to you. Got a reply along the lines of, we all have full-time jobs, we're all very busy, and we're all busy saving the sport from COVID. And I had to take this back to my commission, saying, we'll sort of, they don't have time to have meetings with us. We have time. We're going to make time to meet with them or talk to them. So there was, emails back and forth where we wanted them to agree to sort of certain terms that what is our mandate and what are we signing up for here, because we're being possibly held responsible medico-legally, but we're not, guidelines are not being followed. What's happening? How can we help? What the hell's going on? Pretty much got told in not so many words that this is not a priority right now. We're busy, etc., etc. It made me very upset. I was sort of the last man. The others all said they are not they're resigning. And I sort of said, well, maybe I'll stay and try and find someone to help me. And I realized I actually just can't put myself at that sort of ethical and medical legal risk where I've got and there's nothing I can do about it. People are just doing what they want to do. And at the end of the day, what's going to happen is, unfortunately, someone's going to die and they're going to say, well, we had a medical commission, so Dr. Eliasov must come and explain this, and just can't do it.
Wow. Man. Danella, I'm actually blown away. I didn't think it was going to be that level of I don't even know how to actually phrase it, because I've been, as I'm sure you well know, I've been a very staunch fighter for what's going on in terms of what MMASA have been doing right, what they haven't been doing, et cetera, for many, many years. And that's put me in a very tough position against MMA South Africa, but this has probably pushed me over the edge. I mean, this is downright disrespectful. First of all, on the part of yourself and the other 3 medical practitioners that you brought on. This, for me, smacks of just putting a paperweight in place to say, look, yeah, we've ticked a box, we've got a stamp, we've got a medical commission in place. Oh yeah, guess what? We have a former professional who used to do this thing, so she knows what she's talking about. She's brought the best in the industry. And then when you bring the best in the industry, you bring those protocols, they just throw them away, sweep them under the rug and say, it's not important. So let's take your medical commission hat off and let me ask you this question. If you had a 12-year-old son who had now just qualified to compete under MMASA in the national team at the IMAF Youth World Championships coming up in a couple of months, based on what you've told me now, or you've heard this doctor talk about, and what you've seen, would you be sending your kid under the guidance of MMA South Africa to compete?
I think it actually, a 12-year-old, I think it's a developing brain. It's I wouldn't, no, absolutely not. In fact, as a coach, I mean, I coach some athletes, and I would plan to actually enter them in amateur sort of competition. I don't know if I'm comfortable doing that. I know I always look after them, behind the scenes, but I mean, no, I would not. I consider all the MMA athletes to be colleagues, because they're colleagues, even though I'm retired. It kills me. It kills me because I know amateurs. I know, my ex-teammates at CRT, they're coaching amateurs, and it kills me that, they're the kids that they're looking after are now, no one's looking after them. I had to sort of accept, though, that there was nothing I could do. But I do still plan to work with the pros, and I still plan to make a contribution. But no, to answer your question, I would not let even my 20-year-old who I'm training compete at this stage when things are sort of in this stage medically.
Well, I think that's probably the most damning indictment any organization could ever get. And this at a time when IMAF needs as much support, needs as many affiliations showing that they've got their ducks in order. MMA South Africa have yet again dropped a massive ball. The medical side of combat sports is probably the most talked about component. And I suppose it's even more damning, Danella, following on, I think it was last week, there was the IMAF technical seminar in which quite a number of medical matters were discussed, among them being doping, weight cuts, etc. So this comes as a massive, massive smack in the face for MMA South Africa. I personally am really, really sorry to hear that you and the team of Richard, Evan, and Rob have stepped away. I think MMA in this country has lost a huge fountain of knowledge. I know I've taken professional athletes to Rob on many occasions to go and get checked out, and I know the man is the best at what he does. He is absolutely fantastic. I haven't had much to do with both Richard and Evan, but those that I have spoken to you before, I think it's a massive, massive loss to the sport. The fact that as we talk here, I have reached out to IMAF. I've reached out to the CEO of MMA South Africa. As at the time of us talking here, none of them have responded to my email conversation or my email requests for comment. IMAF has been scarily quiet. And what blows my mind even more is that MMA South Africa seem to be more focused on announcing their national team than they are on trying to resolve the fact that medically they have been found unfit to probably continue working as a fight organization in this country.
Yeah, it was a hard thing to sort of accept as well, because I had sort of almost hoped that, yes, we're going to have teething problems, but it's nice that maybe people are starting to unify the sport and maybe regulate the sport in some way, and perhaps like-minded people, but I've had to accept that they possibly aren't like-minded people. Because it is, I mean, even if I look at the commission I appointed, I mean, to not make use of the free services of, like, you know, three of the greatest minds that you could, you know, and not to mention that we'd asked for opinions from neurosurgeons, neurologists, radiologists, you know, so it really, like, we went to, and at time, I suppose we spent a lot of time drafting their protocol. I was in Sweden at the time on holiday. I locked myself in the cabin for about 3 days and just wrote the protocol. Went on Zoom meetings talking to neuropsychologists about the best way to sort of do concussion screening, things like that. So we really, I mean, not going to come with the nonsense. You know, if I want to do this, I'm going to do it to the best of my ability. And I'm not clever enough to know everything. So I asked people who are much cleverer than me to help. Where we didn't know, we asked a neurosurgeon, we asked a radiologist. So really, we, you know, and strangely, the guidelines would have ended up cheaper than what currently, let's say, for example, EFC had been using. It actually would have ended up being less.
Wow.
Costing less.
So free advice, free assistance, free insight, improving on what is already probably a good system, bearing in mind you've come out fairly unscathed out of your professional career, if we could call it that, and it would have been cheaper, and yet these Muppets have decided not to use it.
Because, for example, EFC, I mean, EFC try, but they don't have someone guiding them, so they would, for example, say you have to do an MRI every 3 years. We looked for research on that, and we looked for evidence. There isn't. Actually, we just need one MRI, and then if we need another one, we'll do one, but you don't. Hepatitis B, every 5 you have to have a test. You don't. You just get vaccinated, and you prove you've been vaccinated, end of story. So it saves that money. Tetanus shots saves you when you have to go, when you get stitches, you have to go and pay for the tetanus shot. Just make sure it's up to date. So there were things that we took away, all this thing of women having sonars and pelvic, and, you know, so that there was no evidence for that. We took it out. We replaced those serial MRIs, what we were going to replace, with concussion testing that would have cost 500 Rand a year, approximately, for a neuropsychologist to assess somebody at a baseline, and then every time they thought they may be concussed, to repeat the testing. It's kind of what they do with rugby, so that the athlete can assess when they're ready to go back to competition. Yeah. So, you know, yes, it costs money, but it's not a lot of money. These neuropsychologists were going to sort of dispense people all over the country to kind of go to the gyms, educate on concussion. What we'd also thought of, where Evan would have come in and things, is prehab. So exercises you should do. So, you know, we all tear ligaments in our knees. We all hurt our shoulder. You know, there's the injuries that we get, but if we're incorporating certain exercises, maybe we won't tear ligaments. The cost of an op on your knee is very high. So we were going to use more sort of preventative stuff. Also with the medicals, pre and post fight, you have to do them anyway.
Yes.
Instead of the lazy doctor doing your blood pressure and saying, off you go, I forced them to examine the person from head to toe, so that they'd actually see if there was something wrong. After the fight, examine them from head to toe, so that if there's something wrong, we know we can sort it out at the event, not later, and then the poor athlete has to fork out the money. That costs nothing more. That's just the doctor has to work harder. Sorry, you can't eat popcorn and watch the fights. You got to work. That was actually the main difference, if I had to say, from how things are. The doctors, I see, they sit in front and they eat popcorn, or they watch. They can't. They must get off their bums and look at the athletes. That was actually the sort of crux of it. So why that is so expensive or fancy, I don't know.
So what I'm struggling to understand, and once again, looking at the post from Wednesday, MMA South Africa have decided to focus on the bare minimum safety and medical guidelines, which what you, if I understand you correctly, what you've brought in makes the bare minimum, okay, far better at a even cheaper than bare minimum cost, which is mind-blowing in itself.
So it's not cheaper than bare minimum, because I think what they're talking about is the IMAF regulations there. much cheaper than what EFC were wanting. So we've actually helped EFC to make their kind of cost to the athletes much less. So the pros is going to be much less. The amateurs, well, they never had to do anything. So obviously it's going to cost them something now, because they weren't needing to do anything from an HIV, hepatitis, COVID testing, whatever, that's not something we can get away from. But I think it was more comprehensive in terms of the fact that the medical they have has to be comprehensive. Things actually have to happen. You cannot send your kid to fight MMA without them and their opponent having an HIV test. I mean, who would do that?
Yeah.
Hepatitis B, even catch-here. You've got to do that. COVID, the government says it. I didn't say it. So
but Danella, for those that don't know that are watching this, at any amateur event that you attend as a fighter, you are required to do an HIV test. You are required to do a certain group of blood tests that confirm that you don't have any of the hep and the HIV, etc., going into the fight. COVID has obviously changed those protocols dramatically globally, with the governments requiring COVID tests to be done in the build-up to big events. Obviously, things like COVID bubbles are also becoming a lovely term to throw around. But in the build-up to nationals, that also didn't take place with regards to all those athletes that competed in nationals. So how does that sit with you as the head of the medical commission?
Sorry, I missed you because your internet or my internet froze for a second. Just repeat the question.
So what I was saying, the requirements from government in terms of COVID testing, that's something new on top of the other amateur blood work requirements at every single amateur event that a fighter needs to cover the costs for. But in the build-up to nationals, those COVID protocols didn't seem to be followed as per government regulations. How does that sit with you as a medical commission?
I cannot speak to that because I don't know. I was not told anything. I didn't even know when nationals were. So I couldn't tell you what they did with COVID testing because I don't know what they did with their medicals in general, unfortunately.
Okay. Well, let's finish this off on a far more lighter note. The last sort of line in your post spoke about, and let me sort of read it out, is that you guys are going to be refocusing your attention on better serving the sport of MMA and safety of its athletes by independent means. Come on, tell me, what is that? There's something there. I can see it. You want to tell me?
I couldn't just leave this. First of all, it was something I worked on for 7 months with Rob and with Evan and with Richard. Couldn't just, it's like, it's important stuff. It couldn't go to waste. And I'm mal for the sport. I love the sport. I can't watch another athlete. I'm not okay with that. So I had spoken in doing the protocol to some sports physicians in Sweden, and so, just asked them what they thought. They loved it. They want it. So I've spoken to people overseas who want to use it. So they can use it because it's not something I would want to profit from, but I'm going to sort of disseminate it in terms of internationally other countries wanting it. Boxing possibly may be interested in, I've been approached there. Do I want to come and, I don't mind to sort of help them out, share what I've learned just from researching these protocols. And then the pros, EFC have been wonderful. They are very on board with us, still helping them out and overseeing the medical. Obviously, things were a little bit grey in terms of the medical commission being affiliated with SAMMA and not knowing what was plotting. Now that we've resigned, I'm going to be helping them at the next event in my personal capacity. So I've sort of implemented some guidelines for them. What we might do is reform the commission, but sort of as an independent thing. So we'll call it something else, and it will still be the same people. We'll call it something, I don't know. Guys, send us ideas for a name. And then we're gonna. How about
just frankly, independent MMA medical commission? There you go. Simple, Simon.
And possibly form an NPO, something like that, and then offer our services to, if a promoter wants us, we can come help. If an individual athlete comes and says, look, I want to look after my brain, I want to, we come. EFC, any sort of pro events that want to use our guidelines, EFC are going to use them at the next event. I am still, for this event, I'm involved sort of alone in a personal capacity. And then going forward, I'm hoping we can reform the commission and possibly assist them implement the protocols as we had intended to do. So with the pros, we kind of, I feel a lot better because I think we're still going to help them and we're still going to look after them. And that's some kind of comfort to me. I'm sad for the amateurs because I feel that they're the ones who maybe needed it more. Youngsters, developing brains, they didn't sign up for this in a way. They're not getting paid to get, we know what we sign as pros. We know the risks. We're getting paid for our trouble. And we're pro fighters. These kids are wanting to go to varsity, finish matric, things like that. So I felt like they needed our attention even maybe more. But so far I can maybe happily say that the pros are going to, we're going to do our best to look after the pros. And then anyone who we're going to try and offer it as a service independently. If it's independent, it also makes us a little bit less liable. If, let's say, a promoter doesn't follow the guidelines, we can say, well, we didn't sanction that event. So, just Agreed. Not really have to sit here and be blamed for any tragedy in MMA when I'm not really I'm powerless to actually make changes or improve things. And this would actually just allow us to look after those who want our help. Yeah.
Well, it's great to hear that very, very positive story coming out of all of this. And I wish you all the best in putting that independent commission together. Don't take my naming convention at all. I'm sure there must be some brighter minds out there.
Some people come up with another one.
Yeah. Final thoughts for you. You must be excited. Just over a week to go before EFC back. A whole bunch of your former teammates are going to be on that undercard. You must be amped.
I'm amped. I'm happy that the sport's coming back from COVID. Really heartbreaking. I mean, that these guys, for some of them, no source of income because they couldn't fight. Also, we love it, and our hearts break when we can't do it. So I'm really happy that the guys are back, and it seems like, things are coming back to the sort of the new normal from this COVID mess that we've had.
Well, Dr. Danella Eliasov, thank you so much for your time. Damn, it's just a pity we weren't talking about the wonderful successes you've had as that medical commission, but there is definitely a silver lining around this very, very dark cloud. Thank you for your time, and I look forward to chatting to you soon once the Independent Medical Commission of South African MMA gets itself up and running and offering its services to all and sundry. Thanks again for your time on this Friday afternoon.
Thank you so much.
Bye-bye.